Urinary tract infections are some of the most common bacterial infections, particularly among women. It is estimated that at least 50% of females will develop a UTI in their lifetime, and 1 in 4 women will have recurring or chronic urinary tract infections. A urinary tract infection is an infection that affects any part of the urinary tract, including the kidneys, ureters, bladder, and urethra. Common symptoms of urinary tract infection include a burning sensation when urinating, frequent urination, cloudy or dark urine, urine with a strong odor, a feeling of incomplete bladder emptying, pelvic pain. The traditional treatment of urinary tract infection is antibiotics. While this form of treatment may kill the bacteria that has caused the infection, it comes along with a host of side effects that can cause long-term diseases. These side effects range from headaches or nerve damage to altering the gut's microbes, which then leads to systemic candida infections and leaky gut, a syndrome that may ultimately result in an autoimmune disorder. Studies show that children treated with antibiotics are also at a greater risk for developing several diseases like diabetes, asthma, allergies, and other autoimmune disorders as they age. Fortunately, there are several natural treatments for urinary tract infections, treatments that leave you healthy and without the many side effects that can occur with antibiotic treatments. Number 1 is probiotics. Probiotics are beneficial microorganisms that are consumed through foods or supplements. Probiotics promote a healthy balance of bacteria in your gut. Probiotics are available in supplement form or can be found in fermented foods such as kefir, kimchi, kombucha, or probiotic yogurt. One study found that Lactobacillus, a common probiotic strain, helped prevent urinary tract infections in adult women. Number 2. Drink unsweetened cranberry juice. For many people, drinking a good amount of cranberry juice at the first signs of an infection can reduce symptoms and bring the body back into balance in a short period of time. This is due in part to the tannin or proanthocyanidin that is found within cranberries and has the ability to reduce the colonization of E. coli. Cranberries also contain polyphenols, antioxidants which have antibacterial and anti-inflammatory properties. Cranberry works by inhibiting the bacteria from adhering to the walls of the urinary tract, reducing the bacteria's ability to grow and multiply. Make sure to choose cranberry juice without added sugar or high fructose corn syrup. Number 3. Increase vitamin C intake. Some evidence shows that increasing your intake of vitamin C could protect against urinary tract infections. Vitamin C works by increasing the acidity of the urine, thereby killing off the bacteria that cause infection. Fruits and vegetables are especially high in vitamin C and are a good way to increase your intake. Red peppers, oranges, grapefruit, and kiwi fruit all contain the full recommended amount of vitamin C in just one serving. Number 4 is D-mannose. This naturally occurring sugar that is found in many fruits such as oranges, apples, blueberries, and peaches, considered one of the most effective natural treatments for urinary tract infections. It works by attaching itself to E. coli, the most common bacteria associated with the urinary tract infections, thereby causing the E. coli to stick to each other instead of the walls of the urinary tract. The bacteria are then eliminated when you urinate. Be sure to drink lots of water throughout the day to help the D-mannose remove the bacteria. D-mannose is not recommended for those with diabetes and if you are taking other medications. You need to talk to a doctor before starting this treatment. Diarrhea is a common side effect. Number 5 is apple cider vinegar. Several studies have pointed to vinegar's antimicrobial effects, which could help fight infections. It has anti-inflammatory properties and balances pH. Urinary tract infections love a non-acidic space. Apple cider vinegar is acidic, which could help balance your pH levels. Research has shown that the acidic acid in vinegar can reduce the growth of E-coli, S. aureus, and C. albicans. Bacteria won't thrive in an acidic environment. Keep in mind, apple cider vinegar should be organic and unfiltered. Number 6 is urusai or bearberry leaf. This herb has been used medicinally since the 2nd century and is probably one of the most well-known herbs for treating urinary tract infections. Native Americans used urusai to treat bladder infections and as a tonic for straightening the kidneys, as well as a treatment for headaches. This herb is not intended for long-term use and should not be used for more than 5 days in a row. Hydroquinone, one of its active ingredients, is a powerful antibacterial. However, if overused, it can cause liver damage. If you are pregnant or nursing, have high blood pressure, kidney or liver disease, do not take this herb. Number 7 is garlic. This superfood has been used for centuries and is one of the first plants documented for its healing attributes. Studies show that due to its antibacterial properties that block the growth of bacteria, garlic is a strong contender as a natural remedy for urinary tract infections. Number 8 is Coleus forscoli. This plant has been used in Ayurvedic medicine for 3,000 years. Researchers at Duke University found that an extract from the plant, known as forskolin, has the ability to flush out colonies of bacteria that hide in the pouch-like structures of the bladder. Once flushed out, antibacterial agents would be needed to finish them off. Number 9 is oregano oil. Oregano is a hardy perennial herb and a member of the mint family. The oil is derived from its leaves and flowers and has antibacterial, antiviral, and antifungal properties and is loaded with antioxidants. It is commonly put in capsules and used to treat nail fungus, thrush, sinus infections, yeast infections, and urinary tract infections. Taking this oil internally is not recommended for pregnant or nursing women, children, or those who are allergic to plants in the Lamiaceae family, which includes mint, lavender, sage, and basil. Prevention is the key, especially if a person has experienced a bladder infection in the past. Drink a gallon of distilled water every day. Eliminate sodas, sugary drinks, and processed foods. Eat more green foods, fresh fruits, and vegetables. Carrot juice, lemon juice, and apple cider vinegar are all good to help change the pH of the body to more alkaline. Disease cannot grow in an alkaline environment.